show to commemorate World TB Day. We would like to start by remembering the millions who have lost their lives to TB, a preventable and curable disease, and stand in solidarity with the millions of people who fall ill with TB each year. The ongoing COVID-19 pandemic has placed an even heavier burden on those affected, leading to disruption of essential TB services and additional death. We salute all the health workers, community workers, civil society, and those who are working tirelessly and at a risk at the front lines of the TB and COVID-19 response. Thanks, health heroes. We have organized this event to ensure a spotlight in the midst of COVID-19 crisis for the 4,000 people who lose their lives to TB each day and 30,000 people who fall ill with TB daily. The theme, "The clock is ticking," conveys the urgency that the world is running out of time to act on the commitments to end TB made by global leaders. This is especially critical in the context of the COVID-19 pandemic that has put NTB progress at risk, and to ensure equitable access to prevention and care in line with the WHO's drive towards achieving universal health coverage. At the start of this week, WHO released new data from 84 countries that highlighted that the impact of the COVID-19 pandemic has been severe, with an additional 1.4 million people estimated to be missing out on access to care in 2020. This takes the total of those who would have missed out on access to TB care in 2020 to over 4 million. It's striking. Furthermore, an estimated 500,000 excess TB deaths could result due to drops in notification, setting the world back a decade to the level of TB mortality in 2010. Since early 2020, when COVID-19 has declared a public health emergency of international concern, WHO Global TB Program with regional and country offices has been prioritizing efforts to end TB in tandem with the COVID-19 response. A real-time monitoring of the impact of the COVID-19 pandemic, including on TB notifications and service delivery, has been undertaken regularly. WHO modeling and analysis on the impact of COVID-19 was undertaken to drive and prioritize action. Key guidance and technical support has been provided to countries to sustain people-centered delivery of TB services, such as home-based care and through use of digital technologies, social support, and other measures and innovations. We also released new guidelines on TB systematic screening this week, along with an accompanying operational guide. This, along with a suite of guidelines and operational handbooks that we have released over the past 18 months on TB prevention, diagnosis, treatment of drug-resistant TB, offer hope for those ill with TB and their families. We need all hands on deck and concerted action by all sectors to build back stronger, learning lessons from the COVID-19 response, to ensure more resilient health systems are in place, and to advocate for rapid innovations such as vaccines, drugs, and diagnostics. The TB vaccine is 100 years old. We can learn from the COVID response, and we should learn to ensure more effective vaccines that can truly drive down the epidemic. Dear friends, we have just 600 days to go to reach the 2022 global TB targets and keep the promises made at the UN high-level meeting on TB. While we struggle to overcome the COVID-19 pandemic together, we should not neglect the millions of people suffering and dying from TB. All lives matter. Every day counts to save lives from TB. This is why I'm very pleased to welcome our distinguished lineup of speakers today. They are powerful voices for the fight to end TB and include TB survivors and advocates, civil society, honorable ministers of health, heads of agencies and partners. We plan to have a very interactive format today. If you have questions, please use the Q&A function on Zoom. This talk show is being streamed on our WHO platform NTB Forum, and we urge our members to also post questions there. To start this one-of-its-kind talk show, I'm very honored to welcome Dr. Zsuzsanna Jakab, the Deputy Director General of the World Health Organization, who will open the talk show on behalf of herself and our Director General, Dr. Tedros. Dr. Jakab, please, thank you for making time and joining us. We would appreciate your opening the talk show with your keynote address.
Thank you very much, Teresa, distinguished colleagues, partners, and friends. The World Tuberculosis Day this year puts the spotlight on the fact that the world is running out of time to act on the commitments made by the global leaders to end TB. This is especially critical in the context of COVID-19 pandemic that has put progress to end TB at risk and to ensure equitable access to prevention and care in line. Data compiled by the World Health Organization from over 80 countries highlight that an estimated 1.4 million fewer people received care for tuberculosis in 2020 than in 2019. Tuberculosis, a preventable, treatable, and curable disease, remains one of the top infectious killers worldwide. With many people with TB unable to access care in 2020, WHO fears that over 500,000 more people may have died from TB. The effects of COVID-19 go far beyond the death and disease caused by the virus itself. The disruption to essential services for people with TB is just one tragic example of the ways the pandemic is disproportionately affecting some of the world's poorest people who were already at higher risk for TB. These sobering data point to the need for countries to make universal health coverage a key priority as they respond to and recover from the pandemic to ensure access to essential services for TB and all diseases. One way to address this is through restored and improved TB screening to rapidly identify people with TB infection or TB disease. New guidance issued by WHO on the World TB Day aims to help countries identify where the needs are in communities and populations at risk of TB and ensure people can obtain prevention and care services. This can be done through a more systematic use of screening approaches that employ novel tools. But this will not be enough. In 2020, in his report to the United Nations General Assembly, the UN Secretary General issued a set of 10 priority recommendations that countries need to follow. These include activating high-level leadership and action across multiple sectors to urgently reduce TB death, increasing funding, advancing universal health coverage for TB prevention and care, strengthening civil society and community engagement, addressing drug resistance, promoting human rights, and intensifying TB research. And critically, it will be vital to reduce health inequities. We must keep the momentum going to stop the spread of this ancient disease and reach those affected with the care they need. We are running out of time. The clock is ticking. It's time for urgent action to end TB. Thank you.
Dr. Jakob, thank you very much for your inspiring words and opening this talk show. We appreciate your strong support and leadership. Thank you once again. I would like now to invite my youngest colleague, a new member of WHO Civil Society Task Force, passionate TB advocate and someone who has won the battle against drug-resistant TB, Fatima Karmadwala. Fatima, please share with us your perspective as a TB survivor and the perspective of the civil society forces on keeping the momentum to stop the spread of TB in the context of the pandemic and reach those affected with the care they need.
Thank you very much. Hi, everyone. It is a great pleasure to be here on such an important day for me personally and for the world of tuberculosis. On World TB Day, I would like to share not only my personal journey battling multi-drug resistant tuberculosis, but I would also like to combine my experience and keep within the momentum of ending the spread of TB and support those that are affected by this deadly disease worldwide. As a civil society task force representative, I take pride in this role. I am a multi-drug resistant TB survivor. I survived 50 days in isolation and 594 days of this life-threatening disease whilst being a university student. I was diagnosed at 20 years of age and finished treatment in May of 2020. I am proud to say that with all the side effects and all the social and economical struggles that come with being a TB patient, I survived. I am now aware that across the globe, WHO is recommending that NDR-TB regimens be changed to just oral medication, and I would like to put a huge amount of emphasis on making this globally adopted. At the time of my treatment, the first 8 months required IV therapy through a PICC line, which was painful and meant visiting the hospital 3 times a week for 8 months. Unfortunately, this is not only time-consuming, but detrimental to the financial stability of an individual. The physical and mental fatigue that comes with this treatment plan, as well as the psychological and physical and emotional isolation, have very lasting effects on a person with TB. I was forced to beg for financial help during my treatment, while still being rejected, which is why I now focus on changing that for other patients. Although tuberculosis medication is free in many settings, what many seem to forget is all the direct and indirect costs that come with being a TB patient. Hospital parking charges, dietary requirements, travel to and from healthcare facilities are all examples of financial strains that TB patients silently face, all whilst losing their source of income. I have taken the steps to work on implementing a catastrophic cost survey for TB patients in the United Kingdom as part of my research study for my master's degree. On World TB Day, we are all here to reflect on key solutions to ensure that we reach a time in the future where no one has to bear the physical, social, and financial impacts of this preventable and curable disease. On behalf of the WHO Civil Society Task Force, I would like to run through the points that we see as critical in getting the countries back on track and see what is missing in order to end TB. COVID helped expose the weakness of healthcare systems. TB infrastructure and services have been weakened and overwhelmed. In some cases, TB response has almost collapsed under the weight of COVID-19. The TB disease continues to quietly spread in the absence of the infrastructure and services to respond to it. To get back onto track, there is a need to double the investment in TB to compensate for the effects of COVID whilst investing in the entire healthcare system to better prepare for emergencies. Also, real engagement and investment in civil society and affected communities needs to translate into capacity building and financial investments as enablers for better response to both COVID-19 and TB. Communities are best positioned to reach the people in need and reach them fast in a friendly manner. To scale up multi-sectoral people-centered approaches to address the social determinants of TB and vulnerabilities, such as poverty, malnutrition, psychological and mental health support. Meaningful engagement of affected communities and civil society is key in this. to invest in data-driven and community-led monitoring system in close collaboration with people who have had TB. This is key to understanding the barriers such as stigma, discrimination, need for social enablers to access and maintain quality care, all related to COVID-19 and beyond. To scale up equitable community-based TB screening and TB preventative treatment for high-risk groups with new technologies together with linkage to treatment and adherence support. I would like to take this opportunity to thank WHO and the Director General for proactive engagement and continued investment in the collaboration with the task force. I am hopeful that the urgency of these issues are seen to in great detail, and change is made now, because there truly is no time like now to end TB. Thank you very much for listening.
Thank you very much, Fatima, for sharing with us your very, from one hand, unfortunate experience, but from other side, very encouraging. May I ask you a question? Where are you from, Fatima?
I'm from the United Kingdom, so I'm based in Preston.
Colleagues, I asked this question not by chance, and you see the TB is everywhere. TB is not so-called old disease that you can meet only in the low-income countries. It's everywhere. It doesn't know barriers and borders, and we need these strong voices of the champions and survivors, but also we should be guided and driven by your needs and by your requests. Thank you very much. We're happy that you are now part of our team. So
thank you very much.
I would now like to give a brief introduction of the sessions and set the scene for our discussion today. We will have two sessions at this event. The first session will focus on country leadership and progress in reaching targets in the face of the COVID-19 pandemic. And we are very pleased to have high-level participation with the honorable ministers of health joining. The second session will be an interactive panel with the heads of agencies partners. This will be followed by an interactive Q&A session with the selected questions curated from the Zoom and NTB forum platforms. Please do type your questions in the Q&A function. And let us now start with the high-level country session. And we are very honored and pleased to have statements from the health ministers from the high-burden countries, from Nigeria, South Africa, Russian Federation, Indonesia, Mongolia. As you are aware, the COVID-19 pandemic has severely impacted the TB response in many countries, including those who are present here today. These countries have stepped up efforts to address both diseases in parallel. Let's hear their experiences. So, and I would like to give first floor to Honorable Federal Minister of Health from Nigeria, Dr. Osagie Ehanire. Nigeria is one of the top 5 high TB burden countries. However, there has been progress made in the country with the highest level commitment from both His Excellency Muhammadu Buhari, President of the Federal Republic of Nigeria, and the First Lady, Her Excellency Aisha Buhari, who joined the UN high-level meeting on TB in 2018, committed to accelerate action to end TB in the country and gave example to other leaders. So please, we are giving floor to the Honorable Minister.
The World Health Organization Director General, health ministers and other high-level government representatives, heads of agencies, TB survivors, civil society and partners, ladies and gentlemen. It is my pleasure to address Your Excellencies and participants at this virtual event organized to mark the 2021 World TB Day. Tuberculosis remains one of the global top 10 causes of death and a leading cause of death from a single infectious disease agent, 139 years after its discovery by Dr. Robert Koch in 1882. Nigeria, unfortunately, is among 8 countries accounting for 2/3 of the global TB burden, a burden further compounded by high numbers of people living with HIV and an increasing number of drug-resistant TB. The emergence of COVID-19 pandemic dealt a blow to our health system, but also to stronger health systems alike, affecting health service provision, including targeted disease control programs, such as the TB control program. This impact hampered TB control efforts in Nigeria for the year 2020. I am pleased, however, to inform you that despite the mentioned negative impact of the pandemic, Nigeria, through dedicated efforts of government and the instrumental collaboration and support from partners, recorded a 15% increase in the number of TB cases notified from 120,266 in 2019 to 138,573 in 2020, of which 95% also were tested for their HIV status. Our country also recorded a high treatment success rate of 87% among all forms of TB in 2020. These achievements were made possible with the effort of government and partners in ensuring service continuity during the pandemic and the integration of TB and other services into the COVID-19 response pillars. The theme for this year's World TB Day 2021 is "The Clock is Ticking," and it is a clarion call for us as a nation to expedite action towards finding missing TB cases and placing eligible clients on TB preventive therapy immediately. We're aware of this responsibility, and we are committed to mobilizing adequate domestic and international funding towards implementing innovative strategies to scale up TB services and achieve the set target for ending TB epidemic in Nigeria. I hereby call on all countries to accelerate efforts towards achieving the set United Nations high-level meeting global targets and commitments by 2022 of treating 40 million people who have tuberculosis. I thank you for your attention.
Honorable Minister and the whole country for really very important and great efforts to provide continuation of the essential TB services. It means a lot, and this is a great example for the rest of the world. So, and at the beginning of our talk show, my leadership, Dr. Zuzana Jakob, asked me how many participants we are expecting, and we know that even during TB Day, World TB Day, still a lot of attention is on COVID-19, and I was expecting it will be good to have more than 100. Now we have close to 200 participants, and the number is growing, and this is extremely important for us. With this, I would like to give a second floor to other eminent speaker, Honorable Dr. Mikhail Murashka, Minister of Health of the Russian Federation. As you know, Russian Federation hosted the first WHO Global Ministerial Conference on ending TB in 2017, opened by His Excellency President Putin, that put us on track to the UN high-level meeting and beyond. Russian Federation, although a high-burden country, is also one fast-tracking progress, and we would like to hear from them about their current situation and progress made to date.
Уважаемый доктор Тедрос, уважаемые коллеги, от имени Министерства здравоохранения Российской Федерации, от себя лично, Рад приветствовать вас на сегодняшнем заседании. Мероприятие проходит в условиях продолжающейся пандемии COVID-19, на борьбу с которой брошены усилия всех стран и международных объединений. В это трудное время выражаю признательность медицинскому сообществу за усилия, предпринятые для борьбы с новой коронавирусной инфекцией и другими инфекционными заболеваниями. Одним из них является туберкулез, ежегодно уносящий около 1,5 миллиона жизней во всем мире. Вместе с тем, борьба с туберкулезом остается неоспоримым приоритетом в работе систем здравоохранения всего мирового сообщества. Необходимость усиления мер по борьбе с заболеванием для достижения цели устойчивого развития и ликвидации туберкулеза была закреплена политической декларацией заседания второго уровня по борьбе с туберкулезом Генеральной Ассамблеи Организации Объединенных Наций в 2018 году. Особую важность в закреплении успехов по борьбе с туберкулезом представляет принятая в ходе 73-й сессии ВАС резолюция глобальной стратегии исследовательской и инновационной деятельности по проблеме туберкулеза, внесенная по инициативе Российской Федерации и способствующая продвижению научно-технического прогресса в борьбе с туберкулезом. Благодарим штаб-квартиру, а также Европейское региональное бюро ВОЗ за совместное сотрудничество и плодотворную работу в борьбе с туберкулезом и отмечаем успех, проведенный в 2017 году в Москве первой глобальной министерской конференции по туберкулезу. По ее итогам был запущен совместный трехлетний проект Российской Федерации и Всемирной организации здравоохранения, направленный на активизацию многосекторальных мер по борьбе с туберкулезом, который был реализован в 2018-2020 году. Реализация проекта позволила в значительной степени активизировать борьбу с туберкулезом на глобальном, региональном и страновом уровнях, особенно в странах с наиболее тяжелым бременем туберкулеза. Учитывая успехи проекта, было принято решение о его продлении на 2021-2023 годы с увеличением финансирования. Российская Федерация демонстрирует высокие темпы снижения заболеваемости и смертности от туберкулеза. Так, число заболевших за последние 20 лет снизилось более чем в 2 раза, а умерших от туберкулеза более чем в 4 раза. По данным глобального отчета ВОЗ в 2020 году, Россия кандидат номер 1 на выход из списка стран с высоким бременем туберкулеза. Все наши достижения обусловлены широким комплексом применяемых финансовых, стратегических и организационных мер, базирующихся на приоритетном отношении государства к проблеме туберкулеза. При поддержке правительства Российской Федерации проводится комплекс медицинских и немедицинских мер, таких как социальная поддержка больных туберкулезом, бесплатное лекарственное обеспечение из федерального и региональных бюджетов, а также санаторно-курортное лечение и реабилитация. Планирование действий осуществляется на федеральном и региональном уровнях. Учитываются уникальные потребности и особенности отдельных регионов. Приоритетным направлением охраны здоровья населения по-прежнему являются программы профилактики туберкулеза, включающие скрининговое обследование населения в целях выявления заболевания. В 2020 году 67% населения страны прошло профилактические осмотры. Для выполнения обязательств политической декларации по наращиванию многосекторального и межсекторального взаимодействия на национальном, региональном и местном уровнях нами проведена большая работа, в том числе обновлено законодательство. Существенные и значительные достижения отечественной фтизиатрии. Введена в практику новая тест-система по лабораторной диагностике латентной формы инфекции. Используются новые подходы к химиотерапии, получившие одобрение Всемирной организации здравоохранения. Также была разработана и исследована инновационная вакцина против туберкулеза, способная оказывать как профилактическое, так и лечебное действие. Нами создан и успешно внедрен Федеральный регистр лиц, больных туберкулезом, который в режиме реального времени представляет данные о каждом больном и позволяет прогнозировать эпидемическую обстановку, позволяет автоматизировать сбор всей статистической информации по туберкулезу. Несмотря на позитивную тенденцию в эпидемической ситуации по туберкулезу в Российской Федерации, как и в других странах, все большую роль играет проблема туберкулеза с множественной лекарственной устойчивостью возбудителя и туберкулеза, ассоциированного с ВИЧ. В последние 3 года нам удалось снизить распространенность туберкулеза с множественной лекарственной устойчивостью. И мы продолжаем разрабатывать новые эффективные лекарства и средства быстрой диагностики туберкулеза. Совершенствуем подходы к диагностике и профилактике туберкулеза у лиц, живущих с вирусом иммунодефицита человека. Следует отметить, что Российской Федерации удалось сохранить позитивный тренд в снижении заболеваемости и смертности от туберкулеза в сложном для нас 2020 году. Мы приложили все усилия для проведения полноценной работы по профилактике, диагностике и лечению туберкулеза, сменив вектор противотуберкулезных мероприятий с учетом пандемии. Вместе с тем ВОЗ прогнозируется рост заболеваемости и смертности от туберкулеза в связи с пандемией COVID-19, и страны, учитывая серьезность этой угрозы, должны приложить все возможные усилия, чтобы не допустить воплощения в жизнь такого сценария, сохранить позитивный тренд в контроле сразу за 2 инфекциями. Только совместными усилиями мы сможем добиться устойчивого снижения заболеваемости туберкулезом в это непростое время. В заключении позвольте выразить признательность странам и представителям неправительственных организаций за участие в сегодняшнем мероприятии, а также выразить особую благодарность генеральному директору Всемирной организации здравоохранения доктору Тедросу за успешную координацию работы и активное вовлечение в дело борьбы с туберкулезом. Благодарю вас за внимание.
And we would like also to thank our eminent speaker. This is a really impressive and inspiring example, and it's critical, it's important that we are not losing focus in the high TB burden countries on TB, and please continue your efforts. My next speaker will be His Excellency, Minister of Health of Indonesia, Budi Gunadi Sadikin. Minister of Health from Indonesia is one of the well-known leaders, and Indonesia is one of the pathfinding countries that has made progress in scaling up access to TB services, including through engagement of other sectors and through the use of innovations. The leadership, His Excellency President Joko Widodo of Indonesia, has been key with his agenda to accelerate efforts towards ending tuberculosis and COVID-19 in conjunction. Investments in TB have also significantly increased. And now we are giving floor to Honorable Minister.
Dr. Tedros, Director General of the World Health Organization, Excellencies, health ministers, and other high-level government representatives, TB survivors, society, and partners, ladies and gentlemen. I would like to express my sincere gratitude to His Excellency, Dr. Tedros, for standing before everyone in this prestigious event in commemorations with the World TB Day. We should emphasize our commitment in ending TB. This pandemic has globally impacted everyone to do things differently. If we want to win the long-standing war against TB, we should bring back together the energy to fight against TB despite the pandemic. As one of the countries with the highest TB burden, it is clear to Indonesia that we need to adapt in order to avoid killing millions. Despite the twofold decrease in the number of TB notifications compared to last year, Indonesia is trying its best to innovate in improving the notification and treatment program through 3 main efforts. First, enforcing advancement on TB screening, diagnosis, and treatment. Community health workers are the key to curb the community diseases in Indonesia. This includes prevention and early screening of TB cases, while also monitoring the compliance of the long prescribed drugs of TB patients. Second, ensuring the availability and continuity of TB-related services for all Indonesians. This is a crucial step, for which we have included TB care in our national health insurance programs, where everyone is guaranteed to have cost-effective access to all TB services. Lastly, engaging cross-sectoral commitments in addressing the TB urgency in national level. The fact that TB is as much a socio-economic issue as it is a health issue makes it impossible to be addressed by Ministry of Health alone. In 2020, President Joko Widodo has established a joint movement to end TB, which declared TB as a priority of national health development and required commitments from other ministries, provinces, and district-level governments, and even private partners in achieving eliminations of TB in Indonesia in 2030. The progress we made today is a stepping stone towards the greater progress and success that await us. With this, hopefully we can reach our goal in reducing TB incidents to 190 for every 100,000 people, and TB mortality to 27 for every 100,000 people, all by 2024. Eventually, we can contribute to the attainment of the SDG 2030 goal for TB. Today, let us all reaffirm our commitments to end TB by collaborating more strategically and fighting more aggressively. Together, we can make TB a history. Thank you.
We would like to thank Honorable Minister for not only for reaffirming of the commitments, but also for following these commitments by concrete and very strong measures, including increase of the investments in TB programs. Now I am pleased to give floor to His Excellency Honorable Dr. Sirijaf Enkbold, Minister of Health of Mongolia. Mongolia bears a heavy burden of TB and is making strides to scale up the TB response in the face of the COVID-19 pandemic. Please, floor is yours.
Эрхэм хүндэт ноён татагтаа та бүхэнд энэ өдрийн мэндийг хүргэе. Дэлхийд дахинд нас баралтын тэргүүлэх 10 шалтгааны нэг нь сүрийн өвчин болжээ. Энэ өвчин эмчлэгдэж, эдгэрдэх хэдий ч 2000 оноос хойш 30 сая гаруй хүн нас барж байгааг дийлэнх нь Аз болон Африкийн улс орнуудад тохиолдож байна. Эдгээр дэлхийн нийтэд COVID-19 цар тахлын нийгмийн эрүүл мэндийн тулгамдсан асуудал болж байгаад бусад халдварт өвчний тусламж үйлчлэгийг охирдуулахгүй байх нь нэн чухал юм аа. Сүрээтэй тэмцэх үйл хэрэгт олон нийтийг анхаарлыг хандуулах, хүн бүрийн хүчин чармаалт чухал гэдгийг сурталчлан таниулах зорилгоор дэлхийн улс орнуудад 1998 оноос хойш сүрээ өвчнөд тэмцэх дэлхийн өдрийг тэмдэглэн ирсэн төвхтэй. 2021 оны энэ өдөр цаг явсаар байна хэмээн дэлхийн нийтээр сүрээ өвчнийг устгах амлалтаа биелүүлэхийг анхааруулж биднээс ихийг хийж бүтээх эрч хүч, шин санаачлагтай ажиллахыг шаардж байна. Монгол улс нь дэлхийн эрүүл мэндийн байгууллагын номхон далайн баруун бүсийн сүрээгийн өвчлөлийн өндөртөө 7 орны нэгд орж байна. Манай улсад бүртгэгдэж буй нийт халдварт өвчний 10%-ийг сүрээ өвчний эзэлж, жилд 4000 орчим сүрээгийн шин тохиолдол бүртгэгдэж, нас баралтаараа халдварт өвчний дотор 1-р орж байна. 2020 оны жилийн эцсийн байдлаар улсын хэмжээнд 3329 шинэ сүрээгийн тохиолдол бүртгэгдсэн. Өнгөрсөн оны мөн үетэй харьцуулахад 295 тохиолдол буюу 8.6%-аар буурсан үзүүлэлттэй гарсан. 2013 оноос 2014 оны тод хийгдсэн Монгол улс дахь сүрээгийн тархалтын түвшинг тодорхойлох судалгаагаар бид сүрээгээр өвчлсөн 3 хүн тутмын зөвхөн нэгийг илрүүлж байгааг бол тодорхойлсон. Энэ одоо бид цаашид хамтран үйл ажиллагаагаа өргөжүүлж зөвхөн салбар дотроо бус нийгмийн халамж, боловсрол, батлан хамгаалах, хэвлэл мэдээлэл зэрэг төрийн болон төрийн бус дотоодын болон олон улсын байгууллагуудтай үйл ажиллагаагаа нэгтгэн зүтгэх нэн шаардлагатай байгааг харуулж байна. Дэлхийн эрүүл мэндийн байгууллагын зөвлөмжийн дагуу Ирипомицийн олон эмэнд эсвэртэй сүрээгийн эмчилгээний хугацааг богиносгосноор өвчтөн дээлтэй болсон. Цаашдаа тарилгагүй богино хугацаанд эмчилгээ хийх боломжийг бол бүрдүүлсэн. Хэдийгээр сүүлийн жилүүдэд энэ өвчнөд тэмцэхийн тулд төсөл хөтөлбөрүүд их хэрэгжүүлж, онцлогоо эмчилгээний сүүлийн үеийн тоног төхөөрөмжүүд онцлоор эмчилгээг хэрэгжилж байгаа хэдий ч өвчлөл, тархалт, нас баралт, орхитой буурах байгааг бол анхаарч ажиллах шаардлагатай байна. Өнөөдөр дэлхийн нийтийг өмнөөс өхрүүлээд байгаа шинэ COVID-19-ийн цар тахлын нөхцөл байдал манай улсад хүн зорилтуудыг авчирч байна. Манай улсад COVID-19 анхны зөөвөрлөгдсөн тохиолдол 2020 оны 3 сарын 10-нд бүртгэгдснээс хойш өнөөдрийн байдлаар 4000 гаруй тохиолдол бүртгэгдэх тохиолдлын тоо бол нэмэгдэж байна. Цар тахлын нөхцөл байдал нь сүрээгийн тусламж үйлчилгээнд тодорхой хэмжээнд нөлөөлөх нь дамжиггүй байна. Сүрээгийн эмчилгээтэй өвчтнүүдийн 37% диспансерын, 30% сум өрхийн эрүүл мэндийн төвийн, 26% сайн дурын идэвхтний хяналтанд, 15% захим хяналттай эмчилгээ хийлгэж байна. Дэлхийд дахинд цаг явсаар байна. Бид анхааралтай авч сүрээгүй ирээдүйн төлөө хамтдаа хийж бүтээж, сүрээгүй, эрүүл, аюулгүй бүс болохын төлөө хамтдаа хичээцгээе. Анхаарал хандуулсан баярлалаа.
We would like to thank Honorable Minister for his deep diving into the problem, for the prioritization. It brings us hope that all these challenges and all these needs will be addressed. My next speaker will be His Excellency Honorable Dr. Zweli Mkhize, Minister of Health of South Africa. South Africa is the leader in rolling out innovations to end TB, from rapid diagnostics to new drugs and preventive therapy. South Africa is a leader in research and also part of the BRICS TB Research Network, very active member. South Africa was instrumental in pushing for the UN high-level meeting on TB that made it reality. I am pleased now to give floor to Honorable Minister.
The moderator, esteemed panelists and guests, colleagues, friends. Thank you very much for this opportunity to reflect on the challenges we have faced as we continue to fight towards the elimination of TB in the face of COVID-19 pandemic. In November 2019, the WHO-led joint review of the HIV, TB, and PMTCT and viral hepatitis programs found that we were on track to attain the 2020 milestone of a 20% reduction in TB incidence rate. At that stage, we did not have any inkling of the storm that was soon to be upon us that would threaten these hard-earned gains. In addition, the results of the South African National TB Prevalence Survey have shown that the incidence rate is actually higher than initially estimated, and that there are about 154,000 people in our communities who had TB and had not been detected. While the target for TB mortality was partially achieved, a significant decline of 19.6% in HIV-negative TB mortality has been recorded, and this is encouraging. As we have reported in the Global TB Report of 2020, our treatment coverage is 58%, while the treatment success rate for the drug-susceptible TB is 71% and 60% for drug-resistant TB. Clearly, this falls short of the national and global targets. However, as I will elaborate in a moment, we have an opportunity to leapfrog towards the desired targets for these indicators by leveraging of the systems we have built and strengthened for the COVID-19 response. We're awaiting the results of the National TB Patient Cost Survey, which has just been completed. This survey aims to determine out-of-pocket health expenditure amongst TB patients and their households to estimate the level of costs to the user. This will assist to inform the implementation of our iteration of universal health coverage, the National Health Insurance, by which we have explicitly expressed in the bill that under NHI, no citizen should pay out of pocket for their essential medical expenses. COVID-19 has certainly made its impact felt in the national TB response. Since the hard lockdown began in South Africa in March 2020, there has been a sharp decrease in TB notifications, patients being initiated on TB treatment, and patients accessing essential health services for the screening, testing, and treatment. Our approach to managing the TB burden in the context of COVID-19 pandemic is to leverage the gains we have made in the health system strengthening over the course of the pandemic, extract valuable lessons learned, and employ those strategies in the national TB response. For example, we are well known for the proactive community screening and testing campaign, which we adopted at the beginning of the COVID-19 pandemic. This strategy not only allowed us to identify high transmission and low transmission areas, but also gave us an opportunity to engage communities on the ground to do better, to better understand the socioeconomic determinants that also need to be comprehensively addressed by government. It also gave us a means to educate the community and for citizens to educate us. Our provinces have been mobilized to intervene using the following strategies. First is the demand creation through communication, social mobilization, and civil society engagement. Next is the integration of TB, COVID-19, and HIV services. Thirdly is strengthening airborne infection control practices in our health facilities. And next is exploring innovations to ensure treatment adherence and leveraging COVID-19 digital health solutions and improving access to social protection for eligible TB patients. And this will be by the results of the TB patient cost survey. Expanding eligibility for latent TB treatment to all households contacts of TB patients, including shorter regimens for the treatment of TB. The South African National AIDS Council, which is led by Deputy President, is currently developing a multi-sectoral accountability framework for TB to ensure that interventions adopted have relevance for our people and achieve the national and international goals towards eliminating TB. Despite all the challenges faced, we remain committed to improving access to appropriate, efficient, affordable, and quality health services for all South Africans and to eliminate TB by 2030. We must thank our development partners, technical agencies, the business sector, and civil society who have forged strong partnership with us towards this goal. We believe the COVID-19 pandemic should be seen as a wake-up call, an opportunity to build resilient health systems and to commit to social solidarity for the good health and prosperity of us all. I thank you.
Now, we would like to thank Honorable Minister. Indeed, COVID-19 pandemic is a big test. It's a very unprecedented challenge for all of us. But it's also big learning, and we should learn together very carefully all the lessons. And one of the urgent tasks to provide a recovery of the essential TB services as soon as possible. I would like to thank once again all our eminent speakers of the first panel, and we now move to the second panel, to the interactive partner panel that put the accent on the urgency of sustaining and restoring TB services during the COVID pandemic and the game changer that can help build back stronger. This panel will be the spotlight on partners, agencies' contributions. And with great pleasure, I would like to begin with Ms. Kerry Pelzman, Acting Assistant Administrator for Global Health, U.S. Agency for International Development, USAID, And as we all know, USAID is the biggest bilateral funder of TB efforts worldwide, and to WHO's work on TB as well. USAID leads the US government's global TB efforts by working with agencies and partners around the world to reach every person with the disease, cure those in need of treatment, and prevent the spread of new infections and the progression to active TB disease. USAID's new TB model, the Global Accelerator to End TB, has also been instrumental in driving progress. Please, Ms. Kerry Pelzman, share with us USAID's vision or role in sustaining support for essential TB services during the COVID-19 pandemic, and vital priorities to get countries back on track to reach End TB targets.
Thank you so much for welcoming me here today to join these illustrious colleagues to mark World TB Day. I'm honored to be among so many esteemed partners as we work together to end TB globally. As others have mentioned, we are all tragically aware of the tremendous toll of the COVID pandemic. However, it is crucial for us to keep sight of other airborne infections that have been devastating the poorest and most vulnerable populations for decades. Reiterating a point previously made by my colleagues that bears repeating, the COVID-19 pandemic has devastated the global TB response. WHO's latest data quantifies this impact by showing that there were an estimated 500,000 more TB deaths in 2020, meaning a total of almost 2 million people died from TB last year. As our work at the US Agency for International Development is data-driven, we would like to acknowledge the World Health Organization for now providing such essential TB data monthly. We've already seen alarming drops in reported TB cases that are exceeding the worst case scenarios predicted by modeling studies. In the 23 countries where USAID focuses our TB programming, 1 million fewer people with TB had access to diagnosis and treatment in 2020 compared to 2019, representing a 23% decline. These countries make up a significant portion of the 1.4 million people included by WHO in its most recent estimates. The countries with the largest declines, many of them in Asia, represent 60% of the global TB burden. As someone who has served in several of these high burden countries, including South Africa, India, our regional mission for Central Asia, it is a shock to me to see the previous gains that we have now lost. As the largest bilateral donor leading the international TB response, USAID is committed to addressing the dual threat created by COVID-19 and TB, and ultimately helping countries get back on track to reach the WHO's End TB targets and the targets set during the United Nations high-level meeting on TB. I want to convey my personal appreciation to Fatima Kardmadwala for sharing her own story as a powerful reminder to us all today of the profound costs faced by each patient behind the data. There's much work to do to achieve our goals, and as you've heard, the clock is truly ticking. USAID is working with the Global Fund to fight AIDS, tuberculosis, and malaria, country governments, and other partners on urgent TB recovery efforts in the countries most affected by COVID-19, while building their capacity to respond to future airborne diseases. Key to these recovery efforts, as Ms. Kardmadwala also highlighted, are inclusive responses by civil society and communities who are able to rapidly implement local solutions to simultaneously respond to both diseases. From the start of the pandemic, USAID's local partners have been critical in finding innovative ways to maintain TB services amid the challenging and ever-changing circumstances brought about by COVID-19. For example, in Cambodia, when movement restrictions hindered access to healthcare facilities, USAID's local partner was able to carry out mobile outreach screenings to continue to find cases and refer patients to treatment. In South Africa and India, TB healthcare workers use innovative mobile technologies to continue TB contact tracing during pandemic-related restrictions. In addition, these health workers and TB contact investigation platforms were adapted and utilized to find COVID-19 cases. When drug-resistant TB wards started treating COVID-19 patients in several countries, including South Africa, Indonesia, and the Kyrgyz Republic, Usaid partners ensured TB treatment continuation while strengthening facilities' infection prevention and control measures, protecting patients from dual infection. And in multiple countries, Usaid partners have supported bi-directional testing efforts for both TB and COVID-19. Efforts such as these, underscored by Usaid's close collaboration with national TB programs, demonstrate that it is imperative to tackle both diseases simultaneously. Recent data show that those with TB and COVID-19 are about 3 times more likely to die than those with just TB. We can't address COVID without also addressing TB in these countries and vice versa. As seen with the COVID-19 response, USAID's TB investments have built critical platforms to prevent and detect the spread of COVID-19 and other airborne infections. Our TB efforts have helped build entire diagnostic networks to include scaling up access to GeneXpert and introducing genotyping technology in Asia, Eastern Europe, and Africa. In addition, USAID's TB investments have trained pulmonologists and healthcare workers in managing airborne infections, established well-equipped facilities to manage infection prevention and control, and implemented contact investigation measures, among others. To regain the progress we've lost and get back on track to achieving global targets, we must work together to develop and further strengthen airborne infection defense platforms. Doing this enables us to create efficiencies, effectively curb TB and COVID-19, prevent the next pandemic, and ultimately save lives. USAID will continue to build the capacity of countries to respond to both TB and COVID-19 with support for bidirectional testing for the 2 diseases, joint contact investigations and community screenings, and implementation of infection prevention and control measures. And in our efforts to do this, it is imperative that frontline healthcare workers are protected, well-trained, equipped, and supported to care for the individuals, families, and communities entrusted to their care. They are our first and most crucial line of defense in combating TB, COVID-19, and other airborne infections. These efforts are vital in helping us address both TB and COVID, reach the WHO and UN targets, and in the longer run are critical in preventing future pandemics. As we've all learned over the past year, we cannot continue business as usual in the way we fight TB. It is critical to innovate and adapt our programs to aggressively fight both TB and COVID and prepare for future airborne threats. Thank you all for your focus on World TB Day and every day.
Thank you very much, Kerry, for your excellent comprehensive view on the problem and the presentation of our perspectives and urgent needs. We all applaud to USAID's continuous and strengthened efforts, support to the countries, close collaboration, and support to WHO. These are real game changers, and these efforts are vital to the countries and to the world. So thank you very much. And we are very pleased also to have today Peter Sands, the Executive Director of the Global Fund, joining us. As we all know, the Global Fund is the top international donor financing TB efforts globally, especially in low and middle income countries. Peter, if you can hear us, please share with us your vision on the current situation. How can necessary resources be leveraged during the COVID-19 pandemic to help countries build stronger resilient systems and reach NTB targets? How is Global Fund supporting these efforts? And I like your background, but we need definitely less mycobacteria.
Yeah. Thanks, Teresa. Look, this isn't the World TB Day we wanted to have. In the year that I joined the Global Fund, we had the high-level meeting, and the world committed to a much more ambitious, accelerated path to closing the gap between those catching TB and those being diagnosed and treated. And we actually saw in 19 and 20 some real progress. We had leaders stepping forward, interventions that were making a real difference, communities mobilized, and we began to close that gap. The stark reality is that we have lost many of those gains, and that here on World TB Day in 2021, we face the prospect of, for the first time for many years, actually significantly more people dying this year of TB than in the year before. And this really should be a call to action, a real, not just a clock ticking, but a real sense of urgency about the need to act. And we should recognize that as we act, we have to do so not just for TB, but in conjunction with the broader response to the crisis. This is not a time where any of us can be sort of focused on one particular disease versus another, because there's no point in saving someone from dying of COVID to have them die of TB or vice versa. In response to the emergence of COVID-19, this time last year, the Global Fund launched a couple of mechanisms, one called Grant Flexibilities, one C19RM, the COVID-19 response mechanism, which on top of our underlying programming were designed to help countries respond very quickly to the crisis, both in terms of direct COVID-19 responses with testing, with PPE and so on, and in mitigating the impact on life-saving HIV, TB, and malaria programs. And thirdly, in doing some urgent fixes and reinforcements to underlying health systems. Through 2020, we deployed 988 million through those two mechanisms, C19RM and grant flexibilities. And what we also saw was really some enormously impressive responses through the TB community, with governments, civil society, partners like Usaid, Stop TB, the Global Fund, coming together with WHO to find ways of mitigating the damage. We all knew the damage was happening. The question was, how much could we stop it? How much could we reduce it? As I reflect back on last year, I think we were perhaps more successful than we feared we might be in terms of ensuring continuity of treatment for those who were on treatment, and less successful than we wanted to be in ensuring continued progress on diagnosis and enrollment onto treatment. As you've heard from previous speakers, case notification in many countries fell dramatically, particularly around those affected by drug-resistant TB. And the sheer scale of that problem is something that we urgently have to confront this year. As we come into 2021, one positive is that the Global Fund is entering a new 3-year cycle of grants. And because of the fantastic support we received at our replenishment in Lyon in October 2019, this new cycle of grants is on average 23.4% higher than the previous cycle of grants. So most of our TB programs around the world have significantly more funding than they had before. And certainly our immediate priority for TB is to ensure that those new grants get going as quickly as possible to maximize their impact, and that they are appropriately adapted to the new COVID-19 dominated context in which we all have to live. In addition to launching the new cycle of grants, we will be shortly launching the next phase of our COVID-19 response. This will have at least $3.6 billion, largely due, not exclusively, but largely due to the extremely generous contribution from the United States. As with the previous phase of C19RM, our COVID-19 response, we anticipate that this next phase will have the same three strands. One, helping countries respond to the pandemic itself, because the reality is the knock-on impact on other diseases won't be counted until we deal with COVID itself. Second, mitigating the impact on the other diseases. And for TB, that means making sure that we can step up and make effective, particularly the case notification side of it, given that that has been so damaged, as well as preventative action. And third, capacitizing, fixing health systems. And this again is absolutely critical to TB, because one of the issues we have seen is diversion of lab capacity for diagnosis, given the pressures from COVID. It's very easy to get very discouraged looking at the situation we face with TB at the moment. But I also think we should take some inspiration and challenge from what we have seen with COVID. With COVID, we have seen an ability by the world to grapple with scientific problems at unprecedented speed. It makes us a bit jealous in the TB world when we look at COVID, how quickly we have gone from having no diagnostics to 9 months, we've got PCR and RTDs. No vaccine, well, we've got one within 10 months. I think we need to re-examine and rethink our aspirations in the TB world around what we really demand as diagnostics, as treatments, as vaccines. If we can do it for COVID, we have to really ask ourselves, why can't we do it for TB as well? And we have to reflect that TB was, and arguably on some arguments, still is a pandemic. But it is a pandemic where, if we're honest with ourselves, we did leave people behind. We have left people behind. We haven't finished the fight. I think it is crucially important that as a global community, we don't do with COVID what we did with HIV and TB, which is to leave the fight unfinished. We have to finish the fight on COVID and truly leave no one behind. But while we're about it, let's do the same with TB. Let's use COVID as the impetus, the catalyst to say, actually, we've tolerated a disease we know how to cure. We've let it kill millions of people. This is outrageous. When we can fix it, we should. And why not now? Over.
Thank you very much, Peter, I can't agree more with all your points. They're absolutely reasonable. And I'm looking again and again at your background, and we can see very simple and funny mycobacteria, but in the same time, we understand how dangerous they are and how smart they are. And these years and decades of neglection strengthen them. So that's why we should not undermine their role. And thank you for reminding this. And thank you for your efforts, personal efforts. You are becoming not only strong, representing strong financial support side, but also you are big advocate yourself for TB. And it's great to see these efforts. Of course, we can have very ambitious targets and commitment, but without adequate financial resources, we will not be able to achieve. And you are doing a lot, but gaps are also well known. Let's try to continue advocating not only for the increased international funding, but also for the domestic funding. Thank you very much once again. With this, now I would like to turn to our close partner and friend, Dr. Luchika Ditio, Executive Director of the Stop TB Partnership. And Luchika, please share with us. You are very smart and very passionate. With this number of missing millions growing, what novel efforts could be used to help close gaps in care as soon as possible? What approaches can be capitalized, including advocacy, awareness, and civil society engagement, building on lessons learned on innovative approaches? Please.
Thank you, Teresa, very much. And actually, I will shorten my presentation. And I have to confess here that listening to Peter, I had tears in my eyes. He started, and thank you, Peter. Really, thank you. We need you, because you see, several of us here, that I don't name because then I will forget someone, but for sure Ariel, and for sure Zuzana, and for sure Teresa. We are in TB business for many years. And you said we have it now in 2021 a World TB Day as we didn't want to have. And we keep looking with amazement, but also with jealousy of how big progress was possible to be done for an airborne disease, for, as you said, exactly all the right things. When the world is getting mobilized and care for themselves and for the others, it's possible to move mountains, So the only conclusion I can have that for TB, actually the world didn't get mobilized and didn't care enough. And there were some people at the forefront for it, funding it, fighting it as much as we could and was done. But it's time to change very much the approach and not to accept anymore, not to tolerate anymore. I was saying today to the Minister of Development from Norway that I am afraid that, TB was there. We had this spike of COVID. We will be able to curb the COVID, but TB will continue, and if anything, will go up. So, I think it's up to us to stand up. And Peter, thank you very much for coming from the banking sector to lead Global Fund and to understand these things and to really be, I think, currently you spoke much better than a lot of our advocates, also using the fact that you come from a different sector, and we need that. And Peter, again, thank you. Sorry, this is not about thanking Peter, and don't think that he will fund now Stop TB or will give me any money or any dinner. I didn't even see him for a year, I think, as many of you. But this is just because, Teresa, you said, okay, what can we learn and what can we do? How we can be innovative and smart. And I will say two things very briefly. One is you mentioned about advocacy, and we need leaders of organizations, leaders of states, and it was amazing to see the ministers that joined here, the ministers that we have. There is a lot of noise on World TB Day happening on social media today, incredible, including heads of states, including the Pope. It's incredible coverage we have this year. So we need that. But we need people, and we need to listen and to have in front of us people and friends like Fatima, and people that suffered and went through the disease, because it's only them that gives not only us a purpose, but can speak and guide us in what should do. as much love, as much empathy and enthusiasm we have to end TB and to help people affected by TB, we will never be able to do that without listening and embracing their work and having, encouraging and supporting them to be our exact partners and leading actually this entire response. So, but in terms of smart things, reality is that COVID is turning us upside down and we cannot neglect that. So what can we do smartly? There are things that can be done this years, because there is a lot of innovation in digital technologies and artificial intelligence that we can use and put in place there. I'm speaking here specifically at going at the community level, either with vehicles that are equipped with tools that are able to diagnose TB and COVID. You can put there, obviously, the molecular rapid diagnosis tests, the Gene Expert, but also MolBio, that the Indian product, identical, that can do TB and COVID. You can put there a portable X-ray, and you can go at the community, or you can place it at the primary health care to ensure that people have an easier access. You combine that with strengthening your diagnosis network and ensuring that you have enough machines, enough tests, that you are able to test bidirectional TB and COVID. And you combine this with what I call a network of communities and civil societies that are able to be deployed and to serve as complete agents of change and push for and advocate and actually discuss with people and, reduce their fears, their questions and their worries, inform them, encourage them to get diagnosed, to bring their contacts, to be tested for TB and COVID, and have them as supporters of treatment. And I tell you that this will be perfect solutions, not just for TB and COVID. There will be perfect solution for any airborne disease, contact tracing, active case finding, scale up of diagnosis with the involvement of civil society and communities, and infection control are actually the pillars of TB that for years and years we were pushing. Now everyone wears a mask. How many World TB Days campaigns we had at a mask? I even have photos that Facebook is bringing now. Remember a few years ago, how many times we were speaking about doing contact tracing and for scaling up our diagnosis networks. If we would have that, we would have been able to fight COVID better. But there is time to do that if we are smart and we don't use these opportunities that we have right now to do this together. It's extremely important because, as we all said, and Tira said as well, and you, Teresa, that by the end of 2022, we really need to get and reach these targets that we set up for 2018. Otherwise, there is absolutely no hope that we are reaching anything by end of 2030. And I think we should be all aware and we should be all accountable if this is not happening without us doing whatever it takes to move the needle. Teresa, I want to thank you and the team for being an amazing partner. We in Stop TB Partnership, we appreciate all the support. Kerry, without Usaid, we would have not been able to be here. We would have not been able to have the civil society and grassroots organizations engaged at the level we have now. And it's one of the few years, if not the first year, in which I really feel a great solidarity within the TB community. We are all running with the same hashtags. We are all running with the same talking points. And, out there, TB is very present. And I want to thank everyone, and Teresa, you and all the partners, and you, Fatima, for organizing and joining this event. Thank you very much.
So thank you very much, Luchika, for your passionate speech. And indeed, this panel, this is a round of close partners, and we are even closer. And this is one of the positive so-called side effects of this very unprecedented pandemic. And thank you, Luchika. My next speaker I would like to invite will be Dr. Philippe Dunator, Executive Director of the Unitaid. Unitaid, as we all know, is leading efforts on innovations to end TB. And you are supporting very important critical projects, especially on country scale-up of TB, preventive treatment in children, household contacts, and those at risk, driving activities, important activities on improvement of MDR TB treatment. This is being promoted through our recently launched guidelines. Please, Philippe, share your thoughts how innovations and research can shape and accelerate TB response in the face of the COVID-19 pandemic. We know that you are working now on new strategy, and how can Unitaid's new strategy role to help drive this?
Thank you, Teresa, and good afternoon, everybody. I would say that my work is now quite easier with the comment of the colleagues, and because it was mentioned by Luchika and fully approve what was said by Peter. I think the case in terms of innovation is absolutely key to respond to the unprecedented situation that we are facing. As you know, also, we are working shoulder to shoulder with Global Fund, Wellcome Trust, WHO in ACTA. And of course, the lesson that we are learning, by the way, is, I think, applicable for fighting TB. So I will not repeat what was said by Peter and supported by Luchika. I think it's very clear that part of the response will be in pushing innovation and also be more ambitious. As mentioned previously, I think there is no reason. We demonstrate the case with COVID-19 that we cannot have better diagnostic, better treatment, and better prevention. So I think the thing is that, again, in terms of priority, we need to understand what does it mean, innovation, because it's a concept that sometimes is not well understood. It's not something that we have to consider, is really the transformation. So again, that one thing is key in innovation is how to think about simplification. Simplification on how to test, simplification to shorter regimen, more adapted for pediatric formulation. And of course, with the push mentioned and the work, but it's a collaborative work on MDR-TB. Of course, simplification means a lot of things in terms of access, but in terms also of results. And by the way, I think that simplification means a lot for the people who suffer from TB, because the burden of TB is not only the disease, but the impact on the life. And of course, be sick cannot be a full job, full time. The second thing is, of course, acceleration. And acceleration in terms of prevention, you mentioned the free HP. I think it's quite important among the people who are living with HIV. And I think that now we are at a stage where we can push the agenda. And of course, countries in South Africa, for example, but others will be key and are key in terms of increasing the access with the support of Usaid and the Global Fund. But I think that there is a next step in terms of using that kind of treatment, rifampicin, for the contact cases. And I think it will be also quite important as in not just for the coming month, but we can expect that the impact of COVID is not just for 2021, but we need to think about what are the response and increase the response in the coming months and years. Transformation is absolutely key. Transformation means that the way that people can get access to services in terms of prevention, treatment, and of course, detection. I think that Luchika mentioned the digital technology. Of course, it has a lot of implication in terms of testing, in terms of imaging, and of course, in terms of maintaining access to treatment. And we have now tools that we are experimenting with colleagues from KNCV for maintaining access to treatment for the people and maintaining treatment. I will finish with something that is obvious for a lot of us, but of course, every time, and we have that situation with the COVID-19, is how to articulate this with the rest of the response. Just to highlight the fact that we have now, at the request of the World Bank, the Global Fund, as therapeutic accelerator with the Wellcome Trust, WHO, UNICEF, looking at how to increase access to oxygen. I think that everybody recognizes that, yes, it's the key issue for the COVID-19 response, but it has effectiveness in terms of reduced mortality, but still there is a challenge in terms of access. It's a chronic situation that affects, of course, the people suffering from TB. So the lesson learned is, of course, we need to be more careful in terms of the demand at the country level, make sure that they have the technical capacity to assess their priority and make sure that they can find a solution. There are many solutions in our tool, but we need to have to support a plan and to make sure that we connect the need with the funding. This is an investment not only for COVID-19, but it has a lot of implication in terms of access for the people suffering from TB. So I will finish there saying that, yes, we need to have breakthrough, transformative innovation, but also we need to make sure that the current needs for the people in the country are addressed. Thank you. Thank you, Teresa. Bye-bye.
So thank you very much, Philippe, for your continuing your important efforts and work. Innovations definitely could be game changers. And while we didn't have still point of care tests, so we don't have effective vaccines, and we have many other gaps and challenges, but in the same time, we should look more carefully at our opportunities. And these opportunities came with much 2-3 times shorter treatment regimens for the patients with the drug-resistant TB, with at least 6 times less pills burden, and better treatment outcomes, fully oral options, and we should rapidly uptake in all the countries. We have, even a few years ago, we had just 1-2 options for the preventive treatment. Now we have at least 6 options, including or treatment for 1 month. And now we are strongly recommending and using more actively rapid molecular diagnostics instead of sputum microscopy. Opportunities are also there. We should be very, very proactive and uptake it as soon as possible. Now I would like to give a floor and to invite Chair of WHO Strategic and Technical Advisory Group for TB, STAC-TB, Dr. Ariel Pablos Mendes. And my question to you as a chair of this important body, what do you see as a key game changers for the TB response to help countries accelerate their efforts to reach NTB targets despite a crisis? How can TB programs contribute to strengthening health systems and preparedness to the threats? What strategic support can WHO provide to realize this? We know, Ariel, that you are yourself very innovative and creative. You are proposing, and some of your ideas and solutions are well known and already implemented in practice. Please share your ideas and your perspectives with us.
Thank you. Thank you very much, Teresa. Thanks to Dr. Tedros for inviting me to share WHO's story at STAC-TB. And to you and Dr. Mingui for including me in this great panel, this very important event. I have very little to add, really. There's so much to be said already, to have been said by great panelists. And I guess with the exception of the once-in-a-century pandemics, like COVID, we have to remind ourselves that TB remains a leading infectious killer in the world. And it has been a scourge for humanity, and almost 40 million deaths since 2000. As Peter said, this is an outrage, and we certainly need to keep that energy as Luchika works so hard every day in getting attention to the problem. So while we're still reeling from the impact of COVID, we cannot afford to regress a decade on tuberculosis, which will be the case if we neglect the programs that had been understandably distracted or closed and so on. We need to work extra hard to overcome whatever challenges. And in fact, we need to find funding and program synergies to be leveraged. And I'm glad WHO has been really paying a lot of attention, of course, to both, but also for the synergies to do so. World TB Day is an opportunity for us to focus on the people who are suffering from the disease and to call for accelerated action. I think this is what this day is about, is for all of us to not only have a great discussion among ourselves and the 100 of people who are joining us today, but to really continue to spread the word and to keep the momentum. The clock is indeed ticking for the victims, but also for the international community and its commitments and targets. There has been a lot of progress, we know, but also we know that we are lagging very much. We were almost half where we should be in terms of mortality reductions from what we pledged in 2018 at the UN. And yet there's progress, and we need to also focus on that, as we have been hearing. I knew tuberculosis in Mexico, where I grew up, and I went to medical school. And when I came to New York for my residency 30 years ago, as Luchika says, I had been on the trenches for a long time. I recognized TB quickly, and we had MDR TB, which was considered Ebola with wings at the time, spreading like fire in New York City on the wings of pretreatment AIDS and homelessness. The experience that Fatima conveyed to us reminds us that MDR TB, like COVID, can strike anywhere, anywhere. We are not safe until we are all safe. We have had game-changing developments in the last decade. The introduction of GeneXpert, many partners are working on that to facilitate treatment, has been really important. It's one of those synergies now in the fight with COVID and so on. But there's still 500,000 cases of MDR TB in the world. We have not really made the dent that we need to. And as a founder and a board member of the Global Alliance for TB Drug Development, an NGO that developed the novel Pretomanid, I'm very proud we now have new drugs to fight this tough enemy after 50 years without them. And BPAL is emerging now as an oral and emerging short course regimen. We should soon replace the current, or should I say, the very old regimens. These efforts have been the result of a lot of collaboration between public and private sectors, partners, and the countries themselves. And we must keep the momentum, because we know, we have learned one thing, is that once you introduce a drug, you're bound to lose it. And so we need to keep the pipeline flowing, as we hear, and we appreciate the collaboration with Usaid. But so we're not there yet. I think the WHO's report estimates 10 million people fell ill, and including 1.2 million children, and 1.4 million of them died. These are numbers that nonetheless are lives, family disrupted, community suffering. And while the domestic resources for health now dwarf those from international development, endemic countries need to do a lot more to meet the challenge posed by TB. A development partner must continue to champion the needs of the poorest countries. We are really grateful, Peter, for the Global Fund increasing funding to fight TB. And I'm also hope that it rises to the level that is commensurate with the burden of the disease. Not to do so will indeed be outrageous. And a special challenge to overcome, beyond the many social determinants of the disease, and in particularly, I would say, in the most endemic countries in South Asia and the Middle East, is the fact that 30–40% of the cases go undetected, perhaps more in this past year. Part of the problem is reaching such patients, but also facilitating access to good TB care. It's also related, nonetheless, to the fact that many people are infected in silence and reactivate here and there with what could be a regular bronchitis and is not identified until people die. So we need to identify those people who have latent TB infection, who have early TB infection. And WHO has to be credited with picking up this challenge, and with partners and countries have now facilitated a scale up. And I think Usaid and Global Fund and many others have been involved in scaling up preventive treatment for people living with HIV, as well as children and households. But we're not there yet. I mean, we quadrupled the numbers, but it's only 4 million, and we're talking about 2 billion people who may already be infected with tuberculosis. So we need simple and inexpensive point-of-care diagnosis for early TB, pre-symptomatic TB infection. A vaccine will be wonderful, but also new drugs that are active against the dormant bacilli, so that we can target high-risk populations with ultra-short, safe, and effective treatments. While I started my career in global health, working in MDR-TB and biotechnology for the poor, over time I realized the importance of transforming health systems towards universal health coverage, not only to ensure access for all to essential services, but also to prevent catastrophic impoverishing expenditure. Those all debates between vertical and horizontals are now moot. There are priorities programs, no doubt, like TB and HIV, and we can build synergies with stronger health systems, just as we did when we eradicated smallpox and at the same time advanced primary health care in the 1970s. Countries and WHO have many priorities, but tuberculosis is clearly a primus inter pares, and we need to prevent catastrophic out-of-pocket expenditures, or worse, private jailing of patients as a result of seeking care. We heard this from our ministers from Indonesia, South Africa, and others. This has to be done. I mean, you cannot be jailed because you sought to be treated. The members of the WHO Strategic and Technical Advisory Group are a very capable and eager group to support WHO and partners and countries in the fight to defeat TB. And I think, well, oh yes, we can. It will take sustained efforts by all of us, research, innovation, advocacy, resources to get the job done. And above all, we need to maintain the high level of political commitment that has been expressed at the UN and as that we have seen recently with COVID, and build back stronger systems, stronger national programs. I think World TB Day is a good reminder that the clock is ticking and we all had to really give it our best shot. Thank you.
Thank you very much, Ariel, for sharing your experience, your wisdom. We are privileged to have you as a STAC chair with us and benefiting from your smart advice and recommendations. So we are moving forward, and it's not the end, dear colleagues. We had two very rich panel discussions, and I would like to thank once again all our distinguished partners and colleagues. And now turn to my colleague, Hannah Monica Diaz, to moderate the interactive Q&A session.
So thanks to all the participants and to the distinguished speakers, and thanks also for the questions that have been pouring in through the Q&A function. We have a range of questions from research all the way down to advocacy and communication. So to start with, let's go with a question that's been asked by Nelson from among our participants on R&D. We spoke about this being the 100-year anniversary of the TB vaccine. So the question is, where are we on, more TB vaccines coming out, more effective vaccines coming out? Is there any ongoing research for vaccines? For this question, I'd like to turn to Dr. Teresa Kaseva to respond. And if any of the panelists would like to add, please raise your hand.
Yes, thank you for this important, vital question, I would say, for us, for all TB community. Yes, the BCG vaccine, it's old, it's not anymore so effective. It can still protect children, especially younger children, from the development of severe forms of tuberculosis, but unfortunately it cannot protect adults. So, but we have also some positive news. We have about 14 vaccines in our pipeline, including one M72 with very promising and successful results out of phase 2B trials. But these results were announced already two years ago, and so still we are not aware so how the processes are moving forward. Though we've tried immediately to bring all the stakeholders together once these results were published to highlight these important results and to promote further. I think that this is time to urgently together move forward with these promising results and new vaccines. Indeed, without vaccines, there is no example in the history of successful elimination of any infectious disease. And that's why we need, and according to WHO modeling, I would remind you, if we will not have effective vaccines at least by 2025, ideally much earlier, we will not have chances to end and to eliminate TB according to our targets and plans. Over.
Thank you very much, Teresa. I see that none of the panelists would like to add. So we turn now to Dr. Luchika Ditio. There is a specific question to you from Kerry Reid on what is the diagnostic tool that you mentioned. As you know, some diagnostic platforms can test for both TB and COVID. It would be great if you could elaborate on this platform.
Yeah.
Over to you.
So thank you, Monica. So to answer to this, I'm referring to the GeneXpert. I'm referring to the GeneXpert machine, to the rapid molecular tests available. So is the GeneXpert machine as well as another product, Indian product from Molbio TrueNut. Both of them are machines. You just need to have different cartridges. And as a matter of fact, they can do TB, they can do COVID, and they can do as well HIV. So you just need to have the right cartridge and the product, to call it this way, from the person sick, which is, similar, not, for TB, you need a sputum, and for COVID, you need a swab, but it's possible to use. So you have the machine, you just change the cartridge and you can do the test if you have enough machines and obviously enough cartridges for TB and COVID. Also, let's keep in mind, because we speak here about lungs for both TB and COVID as being the most affected in general, X-ray. And these days there is X-ray machine that is portable. It's extremely useful. And for COVID is extremely useful, maybe not as a diagnostic tool, but for sure to see the progress and to see how the lungs are looking. It's extremely important. And what we all said about digital technology and artificial intelligence is that you don't need to have the doctors or the expert to be with these tools. If you deploy them in the field, it's possible to transmit the image, is probably to transmit the test through a phone, through a network, and the doctor from wherever he or she sits can read and put the diagnosis. So this is my answer to Kerry. My only point I want to add on the vaccine, everything that we said was right. It took us 10 years to be at the 14 vaccines on the pipelines for TB. And the predictions are at the current level of funding and attention that it will take us additional 5 to 6 to get the vaccine. That should not be acceptable. That is really something that when we say we should all run away. And this is the point that and connection we made with the COVID, that if we were able to overlap different phases, to do them in parallel to whatever we did, secure the funding, the same type of thinking should go into TB as well. Thank you.
Great. Thank you so much, Luchika. I'd like to turn to Peter Sands from the Global Fund to perhaps add a bit more on Global Fund support for rollout. Peter, over to you.
Thanks. Yeah. Well, as part of our COVID response last year, we provided support to a lot of countries on COVID molecular diagnostics cartridges using GeneXpert machines. And one of the things we were very conscious of was the real danger that this would squeeze out TB diagnosis. So we also supported countries in acquiring several hundred more GeneXpert machines and other molecular testing devices. That said, I think there has been capacity pressures on labs in many countries. And I think what we need to be doing now is taking a very concerted, integrated approach to building molecular testing capability. I think COVID and TB have both demonstrated the importance of having sophisticated diagnostics. Many countries have not got the quality of laboratory networks and laboratory data systems to be able to do this as well as is needed, both for COVID and for TB. So sort of building on Luchika's comments, I think it's not just about GeneXpert, there are other providers, but as important, we should be looking to push the development of these technologies. We're seeing with COVID, rapid advances towards much cheaper point-of-care molecular testing tools. These would be of huge benefit to TB as well. So again, there is a real challenge, but there is also a real opportunity to advance the fight against TB through the kind of impetus that we've seen with COVID.
Thank you so much, Peter. That's great. Very comprehensive response. I'd like to now turn to Dr. Philippe Dunator from Usaid to add on this. Philippe, over to you.
Thank you so much. Just to mention, because I didn't say it, that we seize the opportunity of TB Day to launch a new call in the innovative diagnostic. So today, because again, I think that the comment was made that the impact of COVID first is the situation that we know very well, that there is a challenge in terms of detection of TB. And of course, the impact of COVID-19 has affected even that. So it's even more important to have the right tool in detection. And of course, we believe that there is a new step to consider. That's the reason for the launch. So we hope that we will be able to push also new ways to detect TB and to simplify access to tests. Thank you.
Thank you so much, Philippe, for that and for making that announcement. So now moving on to the next question, which has come from Festus from Nigeria. A question that's more on the ground. He asked, how can he get more support from WHO, from partners to carry out advocacy and sensitization in rural areas about TB in Nigeria? So I'd like to kick off this question with Dr. Teresa Kasaiva, if you could start, and then we will turn to Ms. Kerry Pelzman from USAID.
Yes, thank you very much, colleagues, for the question on one of our high burden countries. And definitely Nigeria is one of the priority countries for WHO and for all the partners, I am sure. And one of the clear examples how we can convene is today's participation of Honorable Minister and his commitments. And also another example, we had a high-level mission to Nigeria just before the pandemic and before lockdowns, and it was a very deep diving into the problems with engagement of other sectors, social support sectors, labor sector, how they can jointly respond and to address also not only the health sector problems, but also tackle social determinants. And we all know that the number of missing people in Nigeria was huge, but one important thing happened when we can see, due to our monthly monitoring of data from 84 countries, while almost in all the countries, there are sharp drops in TB notification. Nigeria is managing even somehow increase their notification. And we understand how difficult it is to do in the current situation. That's why we are in close contact with them. We are providing all the needed technical support, advice, guidance, how to address, prioritize the most impactful activities in the current situation. And we will continue doing this for sure.
Thank you so much, Teresa. Ms. Kerry Pelzman, over to you.
Thank you. That was a wonderful response. And I think I just wanted to echo part of what I conveyed, and I think others shared in their remarks as well, the crucial importance and role of civil society and local organizations. USAID has made a deliberate shift in how we've been programming our resources, particularly for tuberculosis, and have now established a local organizations network, which we call TB-LON, because we have to have an acronym for everything. And again, most of our resources for TB are going through such local organizations because, as I highlighted, they can develop locally appropriate innovations and implement them so quickly and be so responsive to specific local needs. So that's more broadly, and I think that's also the case in Nigeria. So we look forward to the opportunity to follow up and ensure, because those community groups and local organizations are really crucial in conveying the information, developing the innovations, and ensuring that the services are continued and provided. Over.
Thank you so much, Kerry, for that excellent response. So moving on to questions, we have time for a few more. There's one question on youth engagement. It says that we have a special, as many of you know, WHO has a special initiative for youth called 1+1 initiative. And the question is, are there any future plans to strengthen youth engagement, and how can youth as a vital group do more? And this, I'll start again with Teresa, but I don't know, Fatima, would you like to add, being a young person yourself and a student? So I'll start off again with Teresa, and I will, I turn to Fatima.
Yes, thank you. And I would like to say that all panelists today are very young because of their energy, because their passion. And we are also representing youth movement here. And when we're talking about young people engagement, it means that they will bring, we hope that they will bring their energy, innovation, their thinking. And I know that all our partners are working with the different youth groups, including Global Fund, Stop TB Partnership, all of them. And I think that they can definitely bring difference with, first of all, sharing and knowledge and awareness that TB is not in the past. TB is still there, and it's unfortunately even becoming stronger. And why we should take care about the problem when it's becoming pandemic or outbreak or a huge threat, and why we are not learning again the lessons. We should pay attention now, because looking in the past, what did happen when we lost control of the situation with TB, later on it takes decades and even centuries to come back. We can very fast lose the control, but it takes much more time to come back and to our normal. So that's why this knowledge should be shared. And I hope that Fatima, as a young person with fresh mind, can have more ideas on how to engage effectively young people.
Fatima, over to you, if you would like to add.
Hi, everyone. Can everyone hear me okay? Okay, yeah. Thank you so much for the opportunity today. I would like to add that I did put a lot of emphasis on the catastrophic costs that I was talking about for TB patients. And I did do that because of the struggles that I had myself. And I would hope that the urgency of the 5 catastrophic points that I did point out are seen as an urgent matter and are, looked into a lot further. Because I feel like, although I am from a high-income country, TB is still prevalent here, just not in low and middle-income countries. So I do hope that the message that I conveyed was enough to make sure that everyone understands the importance of eradicating TB. And thank you so much.
Thanks so much for that, Fatima. It's inspiring to see a young person such as yourself, play this role as a powerful advocate. We really do need more people like you. So now I will turn back. There are many questions, and we hope to take these in the coming days and months. As my colleagues will post on the chat, we have an interactive web-based platform called NTB Forum, where you can communicate on a regular basis. You can post your questions, and we will be in touch. I will now turn back to Dr. Teresa Kasayeva, because we have a special guest. So over to you, Dr. Kasayeva.
Yes, thank you very much. With great pleasure, I would like to introduce our special guest, honorable guest, His Excellency, Minister of Health of India, Dr. Harshvardhan. and he's also chair of World Health Assembly, and recently he accepted proposal and became chair of the Stop TB Partnership Board. Indeed, a very important person in the TB community, and I would like to give a floor. We know how busy is Honorable Minister, and despite of his business, he found opportunity and prioritized World TB Day activities and joined us. So, colleagues.
Dr. Harshvardhan, are you online? Okay.
Despite of distance, I hope that we will provide connection. Just few seconds, colleagues, of your patience. So we see that Honorable Minister is connected with us. Probably,
yes.
In few seconds we can hear and see you.
Sorry, we're experiencing technical difficulties.
But we really appreciate this engagement with us today in this very important day. In fact, we need more days, and one day is not enough. We need weeks, so we need years until we will all together end TB. So still.
Okay, we'll just 1 more minute. We are trying to get the Honorable Minister online. We're just checking with colleagues.
And colleagues, while we are waiting for the connection, I would like to use this opportunity and once again highlight that yes, we are all learning lessons. We are trying to change our mindset, rethink our traditional approaches, and we know that business as usual will not work. But I think one of the important lessons which should be learned from this situation is that TB programs, so-called old programs, are vital for the health system, for the strengthening health system, because we are very well integrated with the primary health care, with the other essential health services. And we have networks of laboratories. We've invested a lot of time, finances, and efforts. We have excellent community, professional community, including community health workers with a strong capacity, with knowledge in airborne infections, with knowledge in the infection control measures, contact tracing, and other important skills. We have healthcare facilities, and now we see how much they are involved in the fight against COVID while continuing providing support and services and care to the patients with TB. And that's why we should learn these lessons and continue our investments in the TB programs, because unfortunately it's obvious for us that TB will remain with us while possibly new threats and viruses can come. No one can avoid this situation. But old programs, as TB is considered as old programs, in the best meaning of this word, should be strengthened and could become vital, essential for the modern, resilient health system. I think that you will all support the vision, and we should strongly advocate all together for this. So I'm checking once again with my colleagues. Is it coming on?
So we have a video statement from the Honorable Minister given the difficulties. We're trying to download it just now. So we're hoping to play it in 2 minutes.
And in parallel, also there are attempts. Honorable Minister would like online to connect, but there are definitely some issues. Colleagues,
sorry, dear colleagues, just a few seconds more.
Can you share your screen? I don't think that these kind of technical issues in the current situation could be considered as a challenge. For us, I think that it's a great opportunity if we will manage to connect and have Honorable Minister of Health and Welfare and Family with us. 8 seconds. I see our audience is still with us. We had during this talk show more than 200 participants, and I hope more people were connected through other platforms and streams, were listening to the stream. So, dear colleagues, I would like to give now floor to Dr. Ren Mingui, WHO Assistant Director General for Universal Health Coverage, Communicable and Non-Communicable Diseases. Dr. Ren is also himself a very passionate leader and strongly supporting for many years TB-related efforts and leading these efforts. Dr. Ren, I would like to invite you to make your statements closer to the end of this very important and event and talk show. Dr. Ren.
Okay, thank you, Teresa. I hope we might have time to download video speech from India. But anyway, I can start with my remarks. Your Excellencies, distinguished colleagues, partners, and friends, I would like to thank all the eminent speakers and the panelists for your strong commitment and support, and also our wonderful audience for joining us in keeping the spotlights on ending TB. Today's discussion at this very important high-level event on TB has been inspiring and productive as we look towards getting the world back on the track to end TB in the midst of the COVID-19 pandemic. It's heartening to see the sparks of innovation and progress on TB, and sometimes together with COVID-19, across many countries in collaboration with partners and civil society, showcased at this event. As we all know, TB remains one of the leading infectious killers, claiming millions of lives and causing suffering to those affected and their families. With COVID-19 pandemic, this situation has worsened, which shows clearly from data collected by WHO, the partners and countries and witnessed by the communities. We need to redouble our efforts to ensure all people with TB access to quality care in line with WHO's drive towards achieving universal health coverage, particularly for the most poor and vulnerable populations worldwide. Given that we have less than 2 years to go to reach 2022 TB targets that will put us on the track to end TB, it is vital that we all unite forces to implement priority actions outlined in the UN Secretary General Progress Report on end TB. We need to support rapid uptake of WHO guidance in the countries to ensure we reach the people with TB care earlier. We need all sectors, all stakeholders, including various governments, agencies, partners, health workers, professionals, communities, and those affected engaged. We need to learn, as we hear from many speakers, from the COVID-19 response and rethink how we can do better in accelerating TB response with innovation and urgency. By working together and showing joint leadership across efforts to achieve universal health coverage and end TB, we can ensure equity care for those most in need and those most vulnerable. We need to keep our promise. The health of millions of people and their families rests in our hands. It is huge responsibility. We cannot let them down. It is indeed, the clock is ticking. Our talk show will be over in minutes, but our efforts should continue and be strengthened. It's time for urgent action to end TB. So with that, I thank you very much again. Over to you, Teresa.
So thank you very much, Dr. Ren, for your unwavering support and commitments. It means a lot, not only for the TB community, for the partners who are here, but for all the millions suffering and unfortunately still dying from the preventable and curable disease. So, dear colleagues, unfortunately, due to technical reasons, we can't right now connect with the Minister of Health, Honorable Minister of Health, Dr. Harshvardhan, but we will share definitely his statement through our platform, and you will be able to hear his bold commitments and his vision on how we can all together manage to find the best and soonest solutions from this crisis. Definitely another lessons that jointly we are much stronger. Let's stay jointly and let's try to do our best for the most vulnerable, for people with TB. I wish you stay safe and healthy. Thank you very much once again.
Thank you. Congratulations.
Thank you very much. Bye-bye.